This is a hugely important piece of legislation in that it is attempting to change the face and the modus operandi of the HSE. And regretfully, and I'm speaking personally at this space, I think that it's like changing the deck chairs on the Titanic, because the good ship HSE is still going to sail on without accountability and without transparency, which are the two issues which the Speaker before me mentioned. And I have many examples, as I know all my constituents who come to me with them, and people from outside my constituency say to me, it's not working, it's not accountable. And let me give a few examples. In Cherry Orchard, in November 2012, a patient died that shouldn't have died. He was brought in a very serious condition from Cherry Orchard Hospital to St. James's, where he passed away. He was in a disgraceful condition medically, and the receiving doctor in A&E who met him expressed serious concern to the family who accompanied him there as to how they hadn't looked after him in his home. But he hadn't been in his home. He had been in a hospital, a HSE hospital. He'd been in there for a long time. He was a victim of AIDS. And when the AIDS ward was closing in Cherry Orchard, because thankfully people were living longer, instead of sending him where the health service, in fact people within the health service, recommended that he be sent to St. Doula's on the north side of Dublin City, that was refused him. And he was kept in Cherry Orchard in a ward which he was not suited to. He was put into a geriatric ward where they had no training, no knowledge, no concern, no care for this man because he had AIDS. And that is an absolute fact, a tested fact, and known. The facts are that the family were deeply concerned about that, and they went to the management in the HSE, and they fought like hell to get an inquiry. The inquiry was set up. No doctor was put on the inquiry to look at the medical issues which were of deep concern to the family. The family rejected the finding of the first inquiry, and they came to me and we got a second inquiry. The second inquiry commenced into the death of this person, and a doctor was put on it. But in the middle of the process, the doctor left the inquiry. He left and the inquiry collapsed because there was no medical person on it. We insisted on a third inquiry. The HSE tried and was unable to get a doctor anywhere in this country to sit on this board for almost a full year. No doctor would sit on it. They requested the Medical Association. Could they nominate somebody to examine and look into this situation, which is appalling and deeply concerning? No one stepped forward. Eventually, they had to get a private company to do it. And the private company then, and this is almost 4 years later as it happened, the family got the truth of the death of their loved one and the reasons why that person died. And it had to do with lack of management in Cherry Orchard, lack of accountability, and many other issues. And the family haven't left it at that because they're looking for a final, how would you call it, a final relief of the burden on that family of the death and the way that man was treated by the HSE. And even now, even today, and I rang the family today, they are being challenged in the courts not by the HSE, but by the legal advisors of the HSE. And this poor man died in 2012, and they still have no closure. And there's no accountability within the HSE for this. It goes on and on and on. The only people who are suffering are the poor person who died and their family. And that's not the end of the story in Cherry Orchard. During the course of our inquiries and FOIs and PQs, we discovered that there were 2 other deaths at the same time in Cherry Orchard. So that there are 3 people died in Cherry Orchard over a very short period of time in 2012. Now, I don't know, and I cannot get, and I won't be given, and I don't want to know the personal names, is what the outcomes of those 2 other separate inquiries were. We were never told when we met the inquiry team, the third inquiry team, that they were looking into the other 2 deaths. And I want to know what the hell was going on. What was happening in Cherry Orchard? Why didn't they tell us what the outcomes of those 2 other inquiries were? And we still don't know if anybody has been suspended. We don't know what has happened, what the outcomes are. And this goes to the heart of what this reform should be about. It should be about transparency of process and accountability. And one of the issues is that medical profession, and I would say, and this is a result of a discussion I had with people within the HSE, there needs to be an independent board, and there must be a due process, obviously, before a case goes to it, that will examine and investigate and look at deaths and other medical issues that have arisen. We heard of other people who have died tragically since, Banny Mahuna, and obviously Vicky Phelan, who's fighting very hard, and a great light for all of us, shining a light into the darkness of the HSE and its operation. But we need now, Minister, and at committee stage, a better decision than to change the names of the people who sit around that board. And putting 2 people in who have public knowledge on that, it all sounds very well and grandiose. It means absolutely nothing unless the HSE is accountable. And we need a body that will invigilate and look at what they're doing separately. And that when people die tragically in hospitals, or when there's significant medical misadventure, that there's an automatic referral to this body, which would have medical expertise provided by the medical professional people. And they are remiss in not coming forward, in not stepping forward and doing their duty, the duty of care to people who are mistreated in our medical service here. They're afraid to go forward. How in the name of God can they stand over their oath if they will not, as a body, as an ethical body, say, we will nominate people who will investigate and look at the reasons why this person has died or why they've been so badly mistreated by this system, which is unaccountable and which is rotten in many respects in this area. And it is an outrage, and it just annoys. Well, when I see people coming to me with cases like this, I say, you know, well, I'll do my best for you. But I know we're voices here. We make our speeches and they just waft off into the air and nobody gives a damn, or do they care? And I challenge them to do something about it now. I challenge this government, my government, to step up to the plate and make sure that there is a proper process, an independent process, a scientific, medically based process backed by the medical profession, that where these issues arise, that they are dealt with clearly, openly, transparently, accountably, and that people are fired for not doing their job. Nobody gets fired. Nobody gets fired in the HSE. You can't even find out if there's even an investigation going on in some cases. You know, it's just not good enough. It's just not good enough. And the other issues that concern me about the HSE are, as I said, the transparency. How can we improve transparency? How can we improve accountability? Well, imagine you're sitting in your office as a TD one day and somebody rings you up and they say, hey, do you know what I just found on the side of the road? Lying in a ditch, a medical record. From where? A hospital somewhere in Dublin. The medical records of patients lying on the streets of Baltray in County Louth. Not once, not twice, but 3 separate occasions. 3 separate occasions. So I advised the person to bring them straight away to the Garda station. That's the appropriate and proper place, because they told me they couldn't. There was no named hospital on the documents that they had. But what they did have was the names of the patients and their treatments. And it's appalling that stuff is found on the side of the road. And here comes the reply from Beaumont Hospital. Dear Mr. O'Dowd, a recent incident occurred whereby personal healthcare information on patients who attended our emergency department was found outside of Beaumont Hospital. It was found in County Louth on the side of the road. On review, the source of the information has been identified as an emergency department summary clinical handover report used by nursing medical staff during shift changeover. So they're changing shift and suddenly this paper takes off and gets on a car or whatever it is and ends up on the side of the road. As a result of this incident, all emergency department staff have been directed to use the confidential bins provided for such reports prior to leaving the hospital. As well, I have written to all the patients personally outlining the causes and details pertaining to the information breach and apologised on behalf of the hospital. Now, that's 3 times that happened, on 3 different separate dates over a period of time. And that's just not good enough. So, if you know the way they treat serious, significant, confidential information in a cavalier is an unacceptable way. And I think that somebody should be held accountable for this. I don't know who they are, but I know we'll never find out because they're not going to do anything about it, are they? So then we look at an issue, and I welcome the interest of the Minister particularly in this matter because she has visited the town of Drogheda on 3 separate occasions at least to deal with the issue in relation to drug abuse and obviously the medical issues pertaining to that. And the context of drug abuse in County Louth is clear by the appalling situation we have, the drug barons and the criminals, violence on our streets, people being shot at in houses, people being intimidated. A woman in my office this week telling me that her son was told that if he didn't pay his debt, and they showed him outside the supermarket the knife they were going to cut her with. Would you believe that? That's the truth. On Monday morning last, that's what actually happened in my office. You know, the proceeds of crime, the criminality and all of that is going on. And on the medical side of it, I have here the information that in terms of significant drug users and the uses of syringes and so on, is a measure, is just a measure, a quarterly measure of the amount of heroin and other substances are being injected in the county of Louth. And the figure is shocking. You're talking about 11,000 on average over a 3-month period in County Louth. And you, Minister, and I and other people have tried to get a needle exchange programme. We've tried to get recognition for an excellent, a top-class voluntary, the Red Door project in Drogheda. And they don't have a proper outreach service because they can't afford it. And when myself and Senator Nash, who is not in this House right now, made representations to the Minister, the official involved wrote a letter naming me and naming Senator Nash as using our political position with the Red Door to get them funding. And what should she do? And what happened? Nothing happened. The project got no funding, at least, and it hasn't got it to date. But what has happened is that almost $500,000 worth of Health Board money has gone into another location in Drogheda with new and additional services which are very welcome. It's one of these services is drug outreach, and that's welcome too. No consultation with Red Door, no consultation with the Gardaí, no consultation with bloody well anybody. So the HSE again is not accountable, and it's not helping where it is critically and essentially needed in dealing seriously with the drug problem in Drogheda and engaging with and involved with and participating and sharing and working together with community groups. What better thing could be done other than that? And if we look at the HSE, God bless them again, and we look at their CHO areas, for instance, the CHO areas of Louth that it's in is totally different to the acute hospital area. So you have one administrative area for community services, and you have a different you have a different acute hospital area. So they're not even joined up in their thinking. But what they do is they set up a group of counties which have absolutely nothing in common. Louth and Meath have a lot in common. We have nothing in common with Laois Offaly and nothing in common with Westmeath and Longford, but they're all in one area. It doesn't make sense. What would make sense would be Louth, Meath, Cavan, Monaghan. That would make sense. That's the way it used to be, and that's the way it isn't anymore. So I think that there's a lot of thinking needs to be done, and at the committee stage of this bill I hope to put in some amendments, if I may, just to challenge the system, and not the Minister, but challenge the HSE to be accountable and to look again at making a better health service work by involvement, by support, and we're dedicating more time to the community. And I acknowledge all the good work, as you have, Cathaoirleach, in relation to the tremendous nurses, the doctors, the staff. They're fantastic. And there are some excellent and top-class administrators. And in fact, in relation to Cherry Orchard Hospital, many of those inquiries, certainly the one I was involved in, would not have taken place were it not for a very good, actually two very good HSE officials who we insisted at the end in getting the full transparency of the situation. But we look at the HSE again, and we look at a thing like the name of a hospital. What does it cost to change the name of a hospital? Well, the HSE in its wisdom has decided that Our Lady of Lourdes Hospital in Drogheda, which has been there since 1950, built at that time by the people of Drogheda, where everybody bought a brick for a fiver or whatever it was at that time. And indeed, right around the whole country, people subscribed to and supported the building of that hospital. Now, the ethos of the hospital changed some years ago, and rightly so, when the HSE, the health board, took it over. And the nuns, the wonderful medical missionaries of Mary, no longer have any role at all to play in it. But the people like the name of the hospital. They like the name, the Lourdes Hospital. And that's what they know it as. I like where I live. I live in a place called St. Mary's Villas. You know, one of our main streets in the town is called St. Lawrence's Street. I like that. I like St. Lawrence's Gate. I don't want to change that. I don't want to change the name. Lawrence's Street, you know, Peter Street or Lawrence Street, whatever. You know, we just like those names. They're historic. They're part of what we are. But the Lourdes Hospital's name is being changed. And there's been no consultation with the people at all. And the people are angry about that. Now, many of them protested about it. One might say, well, you know, what's a name change? Well, it's a fundamental thing to people that you show respect for what's there. And I'm talking about the name, I'm not talking about the ethos. The ethos has changed, and I favour and I fully support a secular health service and a complete separation of church and state. But I don't think it's a good idea, willy-nilly, to start changing names of institutions which are down there. I don't know if they're going to change the name of St. James's Hospital. Is there a proposal to do that? I don't know. I wonder if there was, what it would cost. So I just feel that in issues like this, there's a total lack of sensitivity, lack of awareness, lack of understanding of people who respect and like, you know, what the hospital means to them. So changing the name is rubbish to me, and I don't think it's good. Now, there are many other things I'd like to talk about. I know my time is getting shorter as I go on. But I do feel that you know, that the involvement of public representatives at the end of the day, if your hospital closes in your county, you're in trouble, and I am too. But you'll have no say in that, and you've no forum to go to complain about it, if you do. The only place you can deal with health in this place is in the chamber here with the Minister directly or in the Health Committee. Now, I have a huge interest in health, but when the Health Committee, I'm not on the Health Committee, and if I went in there, I'm sure there'd be 20 others ahead of me. But what I'm talking about is regional accountability, and I believe one of the things the Minister should consider here is that there ought to be a regional health forum which members of the Oireachtas would attend. It should be, say, quarterly, based on their acute hospital grouping, or the CHO health, community health, I don't mind which it is, that they would go to quarterly. There would be an agenda, it would be notified in advance, that you would ask for reports, you wouldn't be challenging them in the context of interfering with their decision making. You'd be saying, but why did you do this? What is happening with that? How can we help you? What's new in this area? But that debate isn't there. There's no debate. There's no knowledge. You know, it's like working, to me, in many respects, I think the HSE is a bit like the Kremlin. Now, I'll be visiting, I believe, Russia very soon, and it's probably the last place I'd like to be in. But like, you don't get answers. You can't find people. Oh God, please don't put in an FOI because you'll be put through the hoops. And as regards meetings, well, you have to request them, you know. And that's what I think is wrong with the HSE. It's not interactive with the political system. And the political system, in a way, is afraid of that responsibility. The Minister will face responsibility every day anything goes wrong. But he has actually no say in what's happening. And this Oireachtas has no say. It has no real input. And there's no, I know my time is up, there's no real understanding. There's no real effort to get a better system, to make it better for ordinary people. And when people like the people I'm dealing with lose loved ones in appalling, disgraceful, shameful, utterly unacceptable circumstances, that they're still fighting for justice 6 years after that person died. That's not good enough. And I think that has to change. Thank you, Caroline.